What's interesting about Medicare is that they actually recognize genetic counseling as a service. They say that certain providers can do it, certain physicians, PAs, nurses, but they just don't recognize genetic counselors, people who are actually trained in genetic counseling, as the providers of
The
those
people who are doing
services.
the work. They recognize your work, but they don't recognize the people and the responsibility to compensate
the
those.
thing is, I mean,
Genetic counseling, just the work that you guys do, is so deeply personal, right? You are encountering patients who are, in some cases, really severely sick. Some cases, these families have been on this diagnostic odyssey, going in and out of the hospital and trying to figure out what's going on before they even, sit in front of you. You mentioned the psychosocial training.
Yeah.
How do you navigate the emotional weight of delivering difficult news to patients and families with, the professional scientific aspect of it?
That's an excellent question. It is. So I started off in prenatal clinics, seeing patients that were undergoing ultrasounds or testing for family history, or something was found on ultrasound. Most time, everything was fine. But when things would come up, it was hard because you're seeing some of these people on the worst day of their life. And sometimes you're the healthcare provider giving them the worst news that they may have ever heard up until that point of their life. And I think it's one of those ones where I don't mean it to sound glib, but it was an honor to be part of working with those patients and those families, because they allowed myself and other genetic counselors, into the conversations to see them potentially at their worst, to see the emotional kind of rawness, really, just when you're finding out some of this information. Even if it was challenging, even if there were times there I wish I could have said something else, I did try to remind myself, I have training in compassionate care. I've worked in crisis situations. And I do remember a time I worked with a physician who one time just kind of came out of the room and was like, "They're crying. I need you to go deal with this." And I remember thinking, I'm glad that I can, and I'm comfortable with crying, and I'm comfortable with things being awkward or not knowing the answer or saying the answer that somebody doesn't want to hear.
This is Genetics for Healthcare, a podcast for patients.
Today, I am privileged to have Kate Wilson, a licensed and board-certified genetic counselor and host of the fantastic All Access DNA podcast. Kate, thank you for being a guest on Genetics for Healthcare.
Thank you so much for having me. I'm excited to be here.
Okay, so we're both on our second podcast here. Stories behind that, of course, but tell me, what's the catalyst for you starting All Access DNA?
Sure. And what's weird is it's actually my third podcast.
Oh, okay, wow.
Because I'm actually operating two simultaneously right now. The reason I started All Access DNA is that I wanted to bring genetics and genetic healthcare to the public. So kind of breaking it outside of the healthcare professional or the people that were already well versed in genetics, and getting it out to the general public, and into mainstream healthcare.
So you and I are two peas in a pod there. And the big thing is just kind of going back, right? So there was the Precision Medicine podcast, which is still a great podcast of the episodes. I did 56 of those. What happened, Kate, is it ended up being our largest audience was industry.
Right.
People who were kind of already in the know. And It was a great opportunity. Don't get me wrong. It's great work. It was a great opportunity for people to kind of come in and have those, inside family conversations around the challenges associated with the scale and access to precision medicine. But I realized that, who we're leaving out is the most important person, and that was the patient and those family members who would benefit from this technology. So this is why we do Genetics for Healthcare, because we wanted to be able to speak directly to those beneficiaries of precision medicine, share those patient stories. When you think about All Access DNA, have you kind of changed who you're speaking to, and why is it important to get this message out through this podcast?
Definitely. And I will say precision medicine used to listen to that podcast quite often, having worked in cancer care, both in clinical and the industry side. So it was nice to be able to have that, honestly, to explore some areas maybe that I wasn't working in at the time. But I think you're right. It becomes more, are we already preaching to the choir, I guess, kind of as it were? So like I started doing the NSGC, the National Society of Genetic Counselors podcast series,
That's right.
which
That's right. I
yeah,
remember that. Okay.
yeah. and then that one was kind of sunset a couple years ago. But fortunately, the Journal of Genetic Counseling came up and said, we want to interview researchers and talk to the folks that are publishing. And so that was a great opportunity again to keep engaged with the field of genetic counseling, to find out what new research was going on. But again, it was kind of, again, speaking to folks that were somewhat in the know. They may not know what this research paper is, but they already had some type of genetic or medicine background. And I think to your point, I was really trying to get to the people whose health is actually going to change, right? Which is the patients and their families. There are people that need genetic services. They have different ways of accessing it or not getting access. I think one of the things that I heard a lot about, especially in the last 10 or so years, was, well, if we like decrease the cost of testing, then everybody will want to do it. But that's not the case. So I was working for a large lab, and it didn't necessarily matter some of the plans that were implemented or seeing what other labs were doing. There's still a huge number of people that were not getting things that they needed or things that they qualified for by like national guidelines. So I think the challenge is access can be a few different things. It's cost, it's insurance, it's finding a healthcare provider that even knows what's out there and what exists. It's finding a healthcare provider that you can get in to see in a timely manner, and that hopefully is recognized by your insurance. And it's also just even knowing what's available. And that to me was the part where I was like, okay, there's something that can be done here in terms of podcasting, which is increasing that knowledge base and just talking to people and helping them understand, oh, these things that maybe 20 years ago were kind of like, oh, it's fancy and it's innovative, are part of everyday healthcare now. They should be part of mainstream medicine. And you as a patient, as a person, have a right to access these services and these tests.
I think that's awesome. So I want to put a pin in the fact that you just kind of gave a little background, because I consider you a triple threat. Okay.
Okay.
You are a clinician. You have worked on the industry side in the largest of diagnostic labs in the country, world, and you're now also teaching in education. But we'll put a pin in that and come back to that. So what I want to get to is to help our listeners understand genetic counseling. Right. First of all, why genetics? What drew you to a career in genetics?
Yeah. Actually, it was my family, which probably makes sense, I guess, in terms of genetics, genes, and things running in a family. But my father was diagnosed with malignant melanoma when I was 7. And we were fortunate that we had access to great care. He was able to travel to like MD Anderson in Houston. He did have a recurrence a few years later, but that was successfully treated as well. Then a few years later, my uncle, his brother, was diagnosed, unfortunately, with metastatic melanoma, had access to great care, but it was too late, unfortunately. And so he passed at 51 due to melanoma. Having these issues, talking to my family members, mostly just dealing with the emotional impact, but realizing, if there's something going on in my family, does that mean there's a way to find out what's causing it? Does it mean that there's a way that we can figure out to prevent this from happening or to find it earlier so it's not too late? I'm 45. I don't mind saying my age, but when I was going through middle school and high school, genetic counseling was not an option, or it wasn't a widely discussed option for careers. So like today I go and talk to like my kids' classes about genetic counseling, but at the time it was hard to find info about it. So it wasn't until college that I learned about genetic counseling as a career. And I really liked that it brought in the medical part of it and trying to figure out causes and treatments for diseases, but it also looked at family dynamics and how people process that medical information and how they try to make it make sense for them.
Absolutely. Let's stay there, because like let's talk about just the requirements to become a genetic counselor. We've had genetic counselors on the show. We've had, oncologists, we've had, other types of medical professionals. But what is it take? What's the education and training like to become a certified genetic counselor?
In the United States, it's usually a 2-year graduate school program, so it's a master's degree. The main coursework tends to be in medical genetics and psychosocial counseling. Like I was talking about, it's marrying that genetic know-how, that genetic expertise, along with how to work with a patient or a family that might be in crisis, helping them make informed decisions, helping them understand their values and how that relates to the testing or the services that they need. And what happens is it's a 2-year period, didactic work, but also lots and lots and lots of clinical rotations. So most of the folks, when they're graduating with a degree, have already been in clinic for at least a year, if not longer, practicing. And then there is a certification exam, which is administered by the American Board of Genetic Counseling. So it's a national exam. And then some states also have state licensure. So some genetic counselors can be licensed in the states that they practice in.
Genetic counseling, just the work that you guys do, is so deeply personal. You are encountering patients who are, in some cases, really severely sick. Some cases, these families have been on this diagnostic odyssey, going in and out of the hospital and trying to figure out what's going on before they even, sit in front of you. You mentioned the psychosocial training. How do you navigate the emotional weight of delivering difficult news to patients and families with, the professional scientific aspect of it?
That's an excellent question. It is. So I started off in prenatal clinics, seeing patients that were undergoing ultrasounds or testing for family history, or something was found on ultrasound. Most time, everything was fine. But when things would come up, it was hard, because you're seeing some of these people on the worst day of their life. And sometimes you're the healthcare provider giving them the worst news that they may have ever heard up until that point of their life. And I think it's one of those ones where, I don't mean it to sound glib, but it was an honor to be part of working with those patients and those families, because they allowed myself and other genetic counselors, into the conversations, to see them potentially at their worst, to see the emotional kind of rawness, really, just when you're finding out some of this information. Even if it was challenging, even if there were times there I wish I could have said something else, I did try to remind myself, I have training in compassionate care. I've worked in crisis situations. And I do remember a time I worked with a physician who one time just kind of came out of the room and was like, "They're crying. I need you to go deal with this." And I remember thinking, I'm glad that I can, and I'm comfortable with crying, and I'm comfortable with things being awkward or not knowing the answer or saying the answer that somebody doesn't want to hear.
Well, thank you for the work that you do. And as a medical professional, okay, I'm from the outside. I understand this, right? From the healthcare system to payers, there seems to be a lack of appreciation for genetic counseling and the job that you guys are tasked to do, to be not only just from the training standpoint, right? I mean, my gosh, you're the subject matter experts. You're the necessary person that a physician who is an MD, PhD in oncology is going to say, well, I'm not well versed in that. Go talk to Kate, right? Traditionally, leading companies in the industry, launching products, I guess the narrative was we didn't have enough genetic counselors, right? There was such a backlog of patients waiting to meet with genetic counselors. In the community setting, some healthcare systems don't even have genetic counselors. Right. But one of our great listeners, Kelly Athman, I'm not sure if you know Kelly.
Yes. I know
certified
Kelly.
genetic counselor from Minnetonka, Minnesota. Shout out to Minnetonka. She sent this to me via LinkedIn. I really appreciate the feedback from our listeners, especially when we misspeak or say something. She said there's actually not a shortage of genetic counselors, and she sent me a link to an article that was published, I guess, on NSGC, and it states in part, I'm just kind of paraphrasing here, Kate, there were over 5,500 genetic counselors in 2021. But today there are over 6,500. Yep. And she says there's enough to meet the need of patient demand for genetic counseling, but it's more of a mismatch in available jobs due to the lack of reimbursement and the subsequent lack of open positions. And what I've experienced is we get these subject matter experts and they go to, healthcare systems, and the workload and the demand that is placed on the genetic counselor. You just talked about the psychosocial burden. Industry ends up snatching them away, right? Come work and be a product manager. Come work and be a product advisor to run a product team. Train our salespeople. Can you talk about, like, what is that? What is the fundamental issue with being able to match the demand in our community
Yeah.
with the appropriate reimbursement without being such a burden of being the only one to service, I
Right.
don't know how many patients, where there's a 6 to 12 month wait to talk to a genetic counselor?
Well, in Rome, I would say, I don't know how much time you have, but this is my other passion area. So there's access to genetic testing or genetic services, but there is also professionally, where is the field of genetic counseling going, and kind of how sustainable, scalable are we making the field? What I would say is, Kelly is absolutely right. There was probably several years ago, they did a workforce study by NSGC, and they did say, okay, there are more patients than we can see currently, right, with clinical positions. True to the can-do attitude of most genetic counselors, they're like, all right, I see that. We're going to solve it. And they basically were just like, we're going to open more programs. We're going to do more training. We're going to get more people prepared to staff the positions and to make sure that we have enough trained experts to meet patient demand. And we did. So that's the good news right there. I think the challenge is that the demand continues to increase and continues to rise. Part of it is industry, honestly, kind of was early adopters. I think some of the folks on the industry side realized, oh, a genetic counselor can do this. On the industry side, it's usually things like the psychosocial comes in terms of helping teams move forward, or translating complicated info into simple to understand. Maybe that's genetic info to a patient. Sometimes, like in my old job, I was translating bioinformatics to the people on the business end. Even though it's not necessarily areas where I had the training in, I could still figure out what's the crux, how do I break it down and make this accessible to somebody at the other end. And so I think industry started hiring a lot of genetic counselors, as you mentioned, for like project managers, marketing, all these different types of positions, which was great. But then I think as those of us on the industry side know, the market started contracting, and we started seeing some mergers and acquisitions. So some startups got bought out, some shuttered. And so, there wasn't as many positions available. And then just with the economics that we've seen post-COVID in healthcare, it's been a bit challenging as well to have the same type of growth on the industry side that we experienced 8 years ago to 10 years ago. The demand is actually still there, and there are still positions available on the clinical side. And there are more that people are trying to advocate for and trying to create because they have the patient populations. They've done all the studies. We need more FTEs in this hospital to provide genetic counseling. And one of the biggest challenges on the clinical side has been reimbursement. So some third-party payers do recognize genetic counselors as providers of genetic counseling. The big one, though, that doesn't, Medicare. So CMS does not recognize genetic counselors as people as qualified professionals who can provide genetic counseling.
What is it going to take for Medicare to do this? Because let's just take a disease like cancer, where the majority of patients in America who are diagnosed with cancer over 60, Medicare aged. And if you can find germline inherited variants, then that informs future generations, right? And so there could be a financial argument made for the utility of, capitating costs downstream, not only access to therapies and clinical trials, okay, let alone that. But what is it going to take for Medicare to recognize genetic counseling as, a medical specialty that should be reimbursed, not just reimbursed, but reimbursed, adequately per the job description and the responsibility that genetic counselors have within a healthcare system? Is it going to take, legislation? How are we going to get there?
Yeah. I mean, legislation is definitely, I think, the biggest mechanism we have to getting this Medicare recognition. So it's something that the National Society of Genetic Counselors has worked on for many, many, many years. And right now it's I believe, I'm trying to get the name right, but I believe it's the Access to Genetic Counselor Services Act. And so there has been a bipartisan act. So we have supporters on both Democrat, Republican sides, that want to see Medicare recognition for genetic counselors. What's interesting about Medicare is that they actually recognize genetic counseling as a service. They say that certain providers can do it, certain physicians, PAs, nurses, but they just don't recognize genetic counselors, people who are actually trained in genetic counseling, as the providers.
The people who are doing the work. They recognize your work, but they don't recognize the people and the responsibility to compensate
the thing is, other healthcare providers can certainly do genetic counseling, but I think you do have something that the genetic counselors bring because that's all that we train for. I think it's sort of like if you are seeing your primary care doctor, they notice a heart arrhythmia, they send you to a cardiologist, right? They don't necessarily do some of that work up in their clinic. Same thing with a genetic counselor. You notice something like this, okay, you want to send them to somebody who has specialty training and qualifications in a certain area. And I think part of the challenge has been that 40-ish years ago, genetics, there's this genetic exceptionalism, right? Genetics is not for everyday medicine, right? It's only for these like special small group of folks. And that's not really the case anymore. Like you mentioned with like cancer, especially affecting the Medicare population, I think about cardiac diseases, I think about neurodegenerative disorders. And in those cases, yes, it can inform family members, but the other thing is some of them now have treatments, genetic informed treatments. So, for example, for like breast cancer, we now have PARP inhibitors. But in order to offer those PARP inhibitors, we have to do some genetic testing. We have moved from here's some genetic information, we don't really know what to do with it, to here's the genetic information. We can offer you a treatment. We can offer you prevention. We can offer you risk reduction. We can offer you clinical trials, like you mentioned. We can offer you research programs. So it's much more proactive than it was 40 years ago.
That's incredible. And maybe I'll ask you this really is, since the Human Genome Project completed, early 2000s, there's the innovations in precision medicine has grown in leaps and bounds, right? And so I mentioned earlier, you were a clinician, you went to industry, and now you teach. Where do you even see clinical genetics going? Like you mentioned cardiovascular disease, which certainly affects many more people than diseases like cancer and other rare diseases. Like, what's the potential? What do you see coming down the line that you're now sharing with those who are training?
I think it's a matter of things that we consider to be multifactorial. So cardiac is a good one. Diabetes is another. These chronic illnesses, right? They have a genetic component. They also have environmental, lifestyle components, so things that you're going to be exposed to. And genetics isn't always the whole story. But what we've learned since completing the Human Genome Project is, like many things in science, it's probably more complicated than we originally thought, right? Sometimes it's not just one gene change that's telling us this is going on. But we're now able to interrogate so many areas and say, okay, because we have this piece here, this component here, this component here, this component here, and they're arranged in this way, we now can even further refine somebody's risk for a certain condition. So I see things like that coming together. You might have heard of like polygenic risk scores. So it's trying to figure out like how all these different components play a factor. The other area that I see like clinical genomics going is better understanding things like the microbiome, so like the gut biome, things when we think about nutrition and like functional health. So again, these are areas that are somewhat more mainstream, or people in the public are looking at things in this area, but there is a genetic component to a lot of these diseases and a lot of these issues. I also think we're going to see a lot more pharmacogenomics, so utilizing genetic testing to help inform or guide medication selection. And that's actually a more recent episode of All Access DNA. Learned a lot about somebody who's a pharmacist and a genetic counselor, which I didn't even know that was a career path one could take. So, but that's like a whole other area that genetic counselors can get into, which is what we all really wanted, was trying to figure out how do we use this genetic information to make somebody's life better.
So everything you said just kind of took me back to where we came from. Right. It's that ripple effect. You see,
Yeah.
downstream, just the many different use cases you just spoke about, not only hereditary conditions, therapy selection, clinical trials, pharmacogenetics, which my gosh, it's here now, and
Yeah.
um, it's paid for. It's paid for. DPYD testing is available for patients with colorectal cancers, which to me didn't really go far enough. But anyway, it's a whole nother subject. But
Yep.
the point being, there's a ripple effect that
Hmm.
if we don't have appropriate reimbursement and appreciation from a payer and healthcare system standpoint with genetic counseling, it can directly impact patient care. Barriers to
Right.
access, delays in treatment, increased burden on the system for not finding, the cause of certain things. Talk about that. How do you
Hmm.
think this could directly impact patient care if we don't really solve this challenge around the recognition from Medicare specifically?
Part of the challenges is Medicare is a huge part of the population. So being able to work with these patients and then get reimbursed for the work that we as genetic counselors do is critical, because a lot of hospitals, a lot of health systems may have limited genetic counselors or no genetic counselors because they don't have a way to reimburse for those services, right? They may not be employing enough genetic counselors to meet the demand. And what's challenging is that there are regions of the country where people have no access to genetic counselors. They're not able, like my dad was, right, to travel to MD Anderson from another state. And so they're not able to go get this information, this guidance. It impacts things like wait time. Like you had mentioned, there's some places where it may take 6 months to a year potentially to meet with a genetic counselor. People may elect not to meet with a genetic counselor because they may have private party insurance that doesn't cover, that visit, which again, most third party payers tend to follow what Medicare states, and what Medicare sets as its guidelines. So that's also important because it doesn't just mean Medicare. It means there's a chance that then we can start working on other insurers. There's so much knowledge and things change so rapidly. So I was training almost 20 years ago. Neuro was not a thing. There was no neuro clinic where I was doing my training. And that wasn't something that we were even aware of. But as we learn more, we know what else we can do. And we come up with tests, we come up with therapies, we come up with treatments. But some of these things, it's just, they're not seen as essential, even though they are, like I said, because they impact like the treatment. I think about a couple of patients that are kind of like flowing through my mind right now that I worked with. The physicians had a hard time keeping up with all this genetic information. There are like, I don't even know, 200,000 different genetic testing products in the US right now. There's so many more every day. So even if we're just looking at that piece of the genetic puzzle, just the testing, that's a lot for anybody to keep up with, who's also seeing patients for a whole host of other things. So a genetic counselor, is trained in this. They can keep up with it. So for example, there was a direct-to-consumer company that showed up 15-ish years ago when I was in clinic. And I saw a patient who brought me, I don't know, a stack of like 60 papers put together of their report and said, I have a BRCA mutation. I have an increased risk of breast cancer. I have surgery scheduled in 3 days to remove my ovaries. Her OB/GYN had set up the surgery. We got through the whole 60 pages. She did not have a BRCA mutation. The testing she had wasn't even clinical grade testing, so it wasn't even the full sequencing. So we ordered that. All of it came back negative. And so she didn't have an increased risk for ovarian cancer or breast cancer. But if we hadn't have seen her, she potentially could have had surgery that wasn't needed. It's not like necessarily the fault of the doctor, but it's like that was a brand new company. So it's hard to keep up with what is this person getting? What is this testing? And how do we interpret these results?
That's a super important point, especially for our audience. And, as I'm talking to experts, I have to continuously monitor myself to make sure the content and the things that we're describing are accessible. So you mentioned something really important. A lot of people in the last 5 years, genetic testing was 23andMe. It was genealogy. It was trace your roots. And many people got that, thought it was genetic testing, and may have taken those results into their doctor, maybe not a genetic counselor, but taken them into their doctor and said, these are my reports. And maybe in this case, the doctor didn't recognize that as not being a clinical grade where you make medical decisions from. Or the other side of the coin, they just dismiss it altogether and they say, well, this is, 23andMe, I can't use that. That's not FDA approved. It's not, medical grade. I can't make decisions on that. And then they just dismiss, genetic insights altogether. Kind of break down what's the difference between like the direct consumer products that people can access as they're scrolling on Instagram or TikTok versus meeting with someone like yourself, a genetic counselor, or having these conversations with a doctor in something that is required for them to order?
I mean, there are some direct to consumer tests out there that can be helpful and that can find what they test for. I think the challenge is kind of how do I figure out what exactly are they looking for on this test? And what happens is you typically order a test, and sometimes it's just a one size fits all, right? It's we're going to look at some things related to cardio, cancer, neuro, wet earwax, whether you process caffeine, all those types of things. So there's some real serious medical stuff in with some things that I kind of think of more as like something fun to share at cocktail parties, but they're kind of like mixed together. And so sometimes it's hard to tease out what has potential medical implications and what doesn't. The other is some of the direct-to-consumer companies may not be doing what I call the full sequencing. So it's sort of like if you're reading a chapter in a book, you really want to see every word, every letter, every paragraph, all of that in the chapter. Sometimes labs, and it happens, like I said, with some of the direct-to-consumer companies, they may only be looking for specific words in that chapter. So you haven't read the whole chapter. You've only seen this word show up 10 times. They may only be looking at half the paragraph or every other page or something like that. So there's things that they can miss. The stuff that they're looking for, sure, they can find it and it can be accurate, but there might be a bunch of other stuff that's super important that they're just not looking for. The point of meeting with somebody like a genetic counselor is to look at your specific health history, your family history, if you happen to know it, and say, okay, instead of getting a one size fits all test, let's see what you truly are at risk for. What are the concerning red flags and what are the things that you have a higher chance of potentially having that we really need to be looking for? And also, which test is going to give us the most informative answer? Because like I said, there's so many testing products on the market.
Great information. As I did mention, Kate Wilson is a triple threat. She is clinician. She teaches clinicians in education. And she's also worked on the industry side, helping companies understand what needs to go into product development to actually meet the needs of patients who need these different genetic tests. Well, and now you're media, so quadruple threat. How about that? So
I like it. I'm putting it on the resume.
Quadruple threat. What impact do you hope to have on this industry of clinical genetics? I know both of our passions is really reaching, patients, non-medical people to kind of help, drive that groundswell of people who are empowered. But through your podcast and the work you're doing today, what impact do you want to have?
I think at the end of the day, I would just love to hear from somebody who said, I was listening to All Access DNA and I realized one of my parents died very young from a heart attack, and that may not be normal. That may be something I need to look into. Whether they end up getting testing or not, they've at least said, okay, I've heard some of these stories on your podcast. I've asked some more questions. I've gotten some more information from my healthcare provider. I think about when I was working on the laboratory side, we actually had a speaker come talk to our sales team. So there was a national sales meeting. They come talk about their journey with cancer. They were diagnosed with a pretty aggressive type of cancer at a very young age. While this person was talking, there were so many flags. And actually myself and some of the other genetic counselors were like, oh my gosh, has this person had genetic counseling? Because there were so many things popping up that we were like, this person, there may not be anything going on, but they should. And so after the speaker came, I reached out individually and said, look, I just wanted to introduce myself and, kind of chatted through. And the person told me, they were seen at a large medical center and not a single provider there had ever spoken to them about genetic testing. And so that's what I want to change, and I don't even want it to be just for the large medical centers. I want people like in rural communities to know that these are available. It's the genetics isn't future. The genetics is now, and we have it, and we're able to do so much with it.
Powerful stuff. So, okay, to that point, Genetics for Healthcare, our mission here is to empower patients to be more effective advocates for themselves with genetic and genomic insights, getting those, understanding them, giving them the language and the confidence to have these conversations with their care providers and also their family members. So I love to ask my guests for 3 practical tips on how they can advocate for themselves in this particular area. So what would you share with those listeners of any practical tips to advocate for themselves to get access to this information?
I love this question, and I love the list because I'm like a list maker. So I like that. It's a good way to kind of communicate some information. I think the three things to remember is one, know your personal health history and your family history if you're able to. There's some folks, that are adopted or they may not be able to know it, and that's okay. Again, that's something you can talk about with your provider, your genetic counselor, about what that means, what your concerns are. If you do notice that there's a pattern and several people in your family have diabetes or have developmental delay, talk to your provider, talk to a genetic counselor. So I think that's the second is like, think about family and personal history. Two, find a geneticcounselor.org. So there is a website where you can go in and you can find genetic counselors. They are not just in large academic medical centers. There's a lot of telehealth options available as well. So you can find some there. So even if you're not able to see one in person at a clinic, they have some telehealth options as well. And sometimes, you can talk to your doctor. They might order the test and then refer you to a genetic counselor. So there's not necessarily one way to see a genetic counselor. That's, I think, the other thing that's changed is how do we provide those services? Probably the third thing is to remember that genetics is just a part of your health. It's not your destiny. It's not a crystal ball. It's not necessarily going to tell us everything that's ever going to happen or encounter, but it does. I've heard somebody describe it like a flashlight, like it's helping us shine a light on certain things, understand certain risks, understand if there are different directions we should be taking, but it's not always the whole picture. So if cancer runs in your family and you don't do genetic testing or genetic testing doesn't find anything, you still want to make sure that you're thinking about like healthy habits, talking to your physician about what are some other ways that you can either find cancer early or reduce that risk. Are there any research studies potentially available that you might qualify for? So just remember that genetics gives us pieces of information, but again, it may not always tell the whole story. And that's why it's important to work with people that have a background in genetics, because not only do they know what the benefits are, they know the limitations and how far that knowledge extends.
Incredible information. Kate, tell the folks how to get in touch with you, how to find your podcast, how can they follow All Access DNA and get in touch with Kate Wilson?
The website's allaccessdna.podbean.com. So that's where you can stream any episode. We're in all the major podcast players, so Spotify, Apple, YouTube. You can also email me, allaccessdna@gmail.com. So I'm happy to take any answers and hear from listeners.
And you can also go to the episode description at genetics4healthcare.com or wherever you might be listening to this podcast. We'll have a link to her podcast. Click, subscribe, follow, like. Kate Wilson, a licensed board-certified genetic counselor and host of the incredible All Access DNA podcast. Thank you for being a guest on Genetics for Healthcare.
Thank you so much.
This is Genetics for Healthcare, a podcast for patients.